Contrave is one of the few drugs approved by the FDA and available in Canada specifically for treating obesity. But how effective is it realistically? And what should you know before taking it? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto, and I manage weight loss patients who have used and are currently using Contrave. And from all their experiences, I'm here to shed some light into what you might expect if you try it yourself. Contrave is a combination drug of both bupropion and naltrexone. Bupropion itself is mostly used as an antidepressant, actually one of the few that doesn't seem to cause weight gain. Naltrexone is an opioid antagonist, that is, a drug that blocks the effect of opioid drugs. It's used by itself often to help recovering opioid addicts or alcoholics to reduce their addiction to those substances. Now, this may seem like a somewhat strange combination for a drug used for weight loss, but it all started when researchers initially noticed that both drugs individually seem to cause weight loss as a side effect. After combining the two, they came up with Contrave, and after studies showed that it both worked synergistically to help with weight loss, the FDA finally approved its use in 2014. You'd be surprised how many uses for drugs are discovered by simply observing and using their side effects. I mean, that's how the popular hair loss drug minoxidil, also known as Rogaine, was discovered. Actually, it was initially used to see if it would help with ulcers, which it didn't, but it sure had an interesting side effect of hair growth. But I digress. How does it work? The mechanism by which it works is unclear, but it's believed to target certain areas of the brain related to eating, such as the pleasurable sensations derived from eating delicious food or feeling full. It seems to focus on reducing the brain's feeding habits rather than increasing fullness signals. The end result is people may end up eating less and lose weight as a result. Side effects. Headaches and dizziness are some of the most common issues I've observed. It can even become debilitating to the point of causing some people to nearly pass out. Nausea is also common, alongside other gastrointestinal issues like constipation, stomach pain, or vomiting. Contrave may also make you feel real jittery or even nervous and anxious. This isn't surprising given that Contrave contains bupropion, which is considered a stimulant. This means it may worsen certain neurological and mood disorders. For example, by potentially increasing the risk of seizures or worsening existing anxiety or panic disorders. For this reason, Contrave is not to be used in those with seizures or with any sort of condition that increases seizure risks. It may also affect blood pressure and is also not to be used in those with uncontrolled hypertension. Contrave may also interact with a number of different drugs, especially other psychiatric medication. So if you're taking other medication, you'll need to let your doctor know. There are some concerns about seizure risks with drinking alcohol while on Contrave, but this risk appears to only be the case if you are a heavy drinker beforehand, then suddenly stop drinking while on Contrave, since sudden alcohol withdrawal is well known to increase seizure risks. Having a few drinks by itself while on Contrave doesn't appear to increase these seizure risks, based on the available evidence. However, some people who do drink alcohol while on Contrave report that it makes them feel sick, or that the alcohol doesn't seem to have the same effect. And even though many people are still able to drink small amounts on Contrave without feeling any side effects, I recommend just staying away from alcohol while on the drug. So if you tend to binge drink or drink heavily throughout the week, you will need to work closely with your doctor first to see if it's safe for you to use. Is it effective? It definitely does not work for everyone, but the patients I've observed in practice for which it does work, it works mostly like an appetite and craving suppressant. It's a kind of different type of appetite suppressant in that it seems to be more effective at suppressing cravings rather than hunger. Check out my video for a more detailed breakdown between the two, but the difference between cravings and hunger is kind of like the difference between wanting to eat and needing to eat. Cravings are a desire to eat. Your body may not need it, but you still want to eat it. Hunger is your body telling you it needs to eat to function properly. Contrave seems to reduce this desire to eat. However, you are still able to eat normally if you wish to. Also, if you're actually hungry, Contrave may not do much to reduce that hunger. I do notice that sometimes it takes a few weeks to actually take effect, so unlike some of the other weight loss tools that start working right away, you might have to take it for a while before anything happens. Also, I find that rebound craving and appetite increases can be very strong upon discontinuing the drug, especially for those who found the drug to be very effective. Should you do it? Contrave appears to be most effective as a craving suppressant. That means that if you have problems controlling yourself with eating things you know you shouldn't, like constantly snacking or constantly eating fast food, it may help give you better control over yourself. If you're an emotional eater and tend to reward yourself with food or eat as a way to soothe negative emotions, Contrave may help you break this emotional connection with your food and might allow you to look at food as a form of nutrition rather than a form of comfort. If you do decide to use it, keep in mind these 4 things. First, you will need to have an effective weight loss diet you are already following or plan to follow. Your selected diet should also be effective at managing hunger properly, since Contrave doesn't seem to be too effective at suppressing hunger. I recommend following a stricter dietary routine, since Contrave can help you to more easily follow and make the right dietary decisions during your diet. Second, you will need to be screened thoroughly by your doctor, since Contrave interacts with and causes problems with numerous drugs and health conditions, particularly neurological or psychiatric issues. Third, even if Contrave is safe for you to use, a lot of people starting Contrave are not willing to continue it for too long due to the heavy side effects they experience. If you're just starting out, the doses are usually titrated up slowly to help reduce these effects. Also, many of the side effects do tend to settle down or even go away after the first few weeks, but battling through those first few weeks of headaches, dizziness, and nausea can be hell, and make it impossible for some people to use it long term. Fourth and finally, when you stop taking the drug, you may find that the strong cravings will return, and if you fail to implement any longer-term dietary or lifestyle habits to deal with cravings and emotional eating, you might find yourself regaining the weight much faster than you lost it. Don't forget to continually build good dietary and lifestyle habits while you're on Contrave. For example, by taking steps to reduce your idle snacking, especially since the drug should help make it easier for you to initially implement those steps and transition them over into lifelong habits. Overall, Contrave may be helpful for emotional overeaters and people with strong cravings to overcome these issues and more easily follow a weight loss diet. The first few weeks of taking it will likely be the most difficult part, since the adverse effects are worse during that time, and the drug may not even be working yet. Let me know in the comments down below if you have any other questions about Contrave or if you have any experiences yourself you'd like to share. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.